I rise today to speak about Indian health care legislation. This is legislation that's introduced by our chairman of the Senate Indian Affairs Committee, Senator Dorgan, and I'd like to talk a little bit about Native Americans and their health care situation. You know, we've spent the last 6 months talking about health care. We've debated the quality of care, the cost of care, access to care. I'm glad to say that we're making progress in fixing what's broken in our healthcare system. But there's one group of Americans who haven't engaged in this national conversation. Americans who suffer from an inadequate healthcare system and alarming health disparities. I'm talking about our First Americans, the American Indians and Alaska Natives, who are suffering because the federal government isn't living up to its promise to them. Right now, Native Americans are being diagnosed with diabetes at almost 3 times the rate of any other ethnic group. Right now, too, many Native American families don't have access to preventive health care. Right now, Native American teens are attempting and committing suicide at alarming rates. The bottom line is, too many Native Americans are struggling to receive quality health care. And for too many years, America has stood aside and let it happen. But today is a new day. It's time for America to make good on its promises to Native Americans. I believe Senator Dorgan's bill would help us do just that. This legislation will bring much-needed reforms to the Indian health care system and will allow us to connect Indian health improvements to national reform efforts. By tying these initiatives together, we will increase our likelihood of success, not just today, but for years to come. This legislation would make reauthorization of the Indian Health Care Improvement Act permanent, so Indian country can better predict and plan for its health care needs. We'll also build on what works by expanding services for mental health and for prevention. We encourage stronger collaboration with the Veterans Administration. We provide resources so that more Native Americans can train to become health care providers. And we promote new ideas and future progress through the funding of demonstration projects. And finally, we begin addressing a tragedy that is tearing apart too many Native American families, especially in my home state of New Mexico. That tragedy is the epidemic of teen suicide, which I spoke of a moment ago. New Mexico's suicide rate is almost 2 times that of the national average, and far too many of these suicides are happening in Indian country. This summer, over the course of a little more than a month, 4 people from the Mescalero Apache Reservation committed suicide. All of them teenagers or young adults. The latest was a 14-year-old girl just last week. In this bill, we will take the first steps in addressing this crisis. We'll fund new grant programs and telehealth initiatives, and we'll expand a program that has proven successful for the Zuni tribe in New Mexico. It's a program that connects schools and parents with the community, where students learn to be peer educators, and the middle and high school students learn life skills to prevent suicide. America has an obligation to provide quality, accessible health care for our country's First Americans. That begins with engaging American Indians and Alaskan Natives in our national conversation about health reform. I'm honored to co-sponsor this bill and look forward to its passage by the United States Senate.